Okay, well, I would like to record, but my computer's running a little slow tonight. Okay, so we're going to talk a little bit about fungal infections that can occur within humans within this chapter. The main reasons why we're even talking about fungi in general is because of the fact of thrush. So we're going to highlight that, and that'll be something that we'll talk about more. I'm not really concerned as much about the different types of infections that can occur from different other areas of the body because, again, it's not really applying to your career field, and it's not something that you're going to see a whole lot of. The only thing would be, a yeast infection down from having it down in your vagina area. And again, caused by the same exact fungi that causes thrush. Okay. So again, how do fungi kind of cause disease? So they're going to just kind of go into the tissue, and essentially they can make, basically they can destroy vital structures. They can also cause an inflammatory response. And there can be sometimes, depending on the type of inflammatory response that you have, there can be toxic effects that go along with it. If you secrete too much of the hormones that are associated with an inflammatory response, that can cause issues. They can also cause for obstructions of different areas if there's too many of the fungi. This includes your lungs and tubules and uterus and the kidneys, bronchi in the lungs. Any type of obstruction of flow of bodily fluids. In addition, you can also have sometimes the fungi can grow within the walls of the arteries and veins, and this leads to necrosis, which is essentially a lack of oxygen to different tissues because of the fact that the blood cannot get to where it needs to get, and the blood carries oxygen. Okay, so fungal infections can be classified into 4 different categories. Superficial mycosis, those are ones that are going to be the outside of the body, so your outside surfaces of the hair shafts, epidermis, so the skin. Cutaneous, so this is going to be like ringworm infections. Subcutaneous and systemic mycosis, these are the most serious, so these are going to be all of your body. Subcutaneous is just like one specific area. So again, ringworm is going to be considered for the fungal infection of the skin. This is going to be caused by various different types of fungi. Again, most of these are going to be caused by various different types of fungi, and we just call them one specific type of infection because that's just easier. Note, again, ringworm has nothing to do with worms, so it is not a protozoa. It does not have anything to do with parasites. Okay, it's just what we call it. These are just some examples of what ringworm looks like. Okay, these are going to be the more severe portions of the fungi section. Again, we have valley fever. This is going to this is a dimorphic fungus. Remember, what dimorphic fungi do? They can act as either both a mold or a yeast, depending on what the temperature is. Again, histoplasmosis. And cryptococcytis. Again, we can also get pneumonia. Most anything that's involved your lower respiratory tract is going to involve pneumonia. So this can be both. This can be caused by specifically this pneumonia specific fungi. They used to be considered a protozoa, but now they say it's more of a fungi. Again, either one. The problem is at the end of the day, it causes interstitial plasma cell pneumonia. Okay, so this is just how essentially yeast invade the tissues, just basically different things. Okay, so the big one here, Canadian albicans, as if I haven't said this enough throughout the semester. So this causes thrush, which is a yeast infection within the oral cavity. So Canadian albicans and other related species. The most common cause of thrush is usually Canadian albicans, but it can be caused by other related species as well. But the idea here is that this is essentially a yeast infection within the oral cavity. What happens is you get this creamy white patches that occur in the tongue and underneath of your tongue and the mucous membranes and on the corners of your mouth. Again, it just means it's a yeast infection. You take some medication, you're good to go. Okay, so this is just some pictures of thrush. Okay, in addition, you have yeast vaginitis. Essentially, this is what we call a yeast infection more commonly, and it's found within your vagina. And it's, again, caused by Canadian albicans. So they're not just found in your mouth, they're also found down in the vagina area as well. Pretty much the Canadian alcapans can be found pretty much anywhere you have a mucous membrane or mucous lining of some sort where you have a normal flora, because they're a part of your normal flora. So the idea here is that you have to have an extreme amount of yeast in order for you to have what we call a yeast vaginitis or a yeast infection, because most of the time you do have contain about 25% of healthy women do contain some type of Canadian alcapans within your vaginal area and the vaginal normal flora. Okay, so various species. Again, just like everything else, we can also have infections of the central nervous system. This would be considered meningitis. Again, you will see this within this can also become caused by fungi. It's not as common as viral meningitis and bacterial meningitis. Those are more common, but you can see this as well. Okay, and that's the end of this one. So I will go ahead and post this one online for you. And remember, this will be the end of the course. So this will be everything that will be on your exam, final exam for this semester.